October is Breast Cancer Awareness Month. Everyone talks about get your mammograms, and there's a big push towards screening for breast cancer in the month of October. Let's talk about the difference between screening and prevention. So screening is early detection, and that's important for cancer. If you catch a tumor in your breast that's cancerous when it's teeny tiny in size, it's going to be a lot easier to treat than if it's large. You know what's crazy though? The survival rate isn't that much difference between whether it's small or large. Even if that's the case, we're talking about the difference between a lumpectomy and a mastectomy, which is removal of the whole breast. A lumpectomy is just removal of the tumor and a surrounding margin that hopefully has no cancer in it. So there is value, in my opinion, to screening for sure. And the peace of mind you get when you get the all clear. Breast cancer affects 1 in 7 women. That's an increase significantly in the last 60 years since the 1960s. Used to be 1 in 20 women. Now it's 1 in 7. So screening is important, but we also want to think about risks of screening. Are there risks of screening? Well, there are. One of them is the overdiagnosis of cancer, or the overdiagnosis of things leading to painful procedures to prove you don't have cancer. Did you know that 8 out of 10 biopsies are normal? I'm really glad for those 8 out of 10 biopsies. Women, right? They don't have cancer. I'm really happy to hear that. However, they had to go through a biopsy, which has risk of hematoma infection. It's super scary because there's a several week time frame where you don't know, right? You get the call back, you have an abnormal mammogram, we need additional views. Whoops, now we need to do a biopsy. That's several weeks of this woman being very anxious, concerned that she might have cancer, going through all the what ifs in her mind. And then she gets the biopsy and she finds out she doesn't have cancer. Yay! Sometimes they're so grateful that they don't have cancer that they forget about, holy cow, is there anything that could have been done to prove I didn't have cancer short of all that anxiety? One thing to consider here is the only way to know for sure whether something is cancer or not is to have a tissue sample. You have to be able to look at the tissue under a microscope, evaluate whether the nucleus looks normal or abnormal, and evaluate the surrounding tissue to see if multiple cells are abnormal and if there's any break in what we call the basement membrane that something has spread. We don't want to be lopping off women's breasts just to prove they don't have cancer. So we got to have something that gives us good information between not knowing anything and getting the all clear. Also, the risk of biopsy. Not long ago, I had a patient in my practice who had her mammogram. She went through the workup, was told that she had an abnormal area. They did the biopsy. The biopsy came back, no cancer, and she was very happy about that. However, she developed a hematoma, a very large hematoma, and needed a surgery. And now she has scarring and disfigurement from that surgery to remove the hematoma, which is a big blood clot, all to prove she didn't have cancer. Please know that I'm not saying don't get mammograms. I'm just saying it's time for informed consent. We just need to have this honest conversation. Screening has value. It also has risks. If you're not aware of all your options for breast imaging, that I'm going to do in a different video. There's more options now than just mammogram. So you deserve to have informed decision making and an honest conversation about everything. Using a mammogram, another risk is actually that radiation causes cancer. We are radiating women's breasts looking for abnormal calcification clusters on a mammogram that would suggest the potential for cancer, but the radiation actually is a risk for cancer. Now, with the amount of radiation delivered in an individual mammogram, it's not a high risk. However, the concern that we have, honestly, the risk is cumulative over time. So it's not just one mammogram that a woman is getting, it's multiple. And for the women who have multiple callbacks for additional views or who start their screening earlier because of a family history, they're going to get a lot more mammograms than the average risk woman, and they may already have a heightened risk for breast cancer, and now we're adding extra radiation on top of that. It's a concern. We have to be honest about this. Therefore, if there were other options that didn't have the radiation and had very good imaging, would that be something that might be considered superior? Mammograms have been around since the 70s and not much has changed. Are we really doing our due diligence in looking for alternative methods that have less risk? Lastly, let's talk about about detection versus prevention. So these detection methods do nothing to decrease your cancer risk. And as I just pointed out, some of them may actually increase your cancer risk. The best chance at preventing cancer is a healthy immune system. We get cancer every day, and our God-given immune system detects those abnormal cells and gets rid of them before they turn into cancer. That's your best chance at cancer prevention. What can we do to support our immune system? Number one, optimize your vitamin D and your other micronutrients like zinc and magnesium. We need to know what those levels are if we're going to optimize them. Number two, get enough sleep. You need 7 to 9 hours a night. Many people don't get enough sleep. Number three, learn how to relax your nervous system. We live in the fight or flight nervous system, which is the sympathetic nervous system, almost 24/7 nowadays, and it's not healthy. Your immune system is not active during that time. Your immune system is strongest during the parasympathetic, relaxed nervous system, and that's how we need to learn to tap into that. In our practice at Vitality Renewal, we work with our patients on these things. Relaxation is so important, and it's even more important if you don't have time for it, right? Because that means you're extra stressed. Let's learn how to prioritize that. Number four, don't eat crap. Eat whole foods. Minimize your sugar intake. It would be ideal to eliminate it. I know that's probably not practical, but minimize sugar and things that turn into sugar immediately. If you do those things, you are taking a huge step to support your immune system and prevent cancer. October and Breast Cancer Awareness Month should be a lot more than just go get your mammogram for screening. It should really be talking about how do we prevent breast cancer. I'm Dr. Yvonne Carney. I hope you found this helpful. Subscribe or follow me and pass this on to a loved woman in your life that needs to hear this.